Good evening and good evening. It is now exactly 17:57. My name is still Dr. Luvuyo, Bayeni, the host for Dr. B Talks. Yes, we are going to start promptly at 1800 hours, but because we value your time and we wanted to be sure that all the technical glitches are sorted, we have also opted to make sure that we come and log in and wait for you here. Yes, we are waiting for you because we value you so much. So welcome to Dr. B Talks, and yes, this is another exciting episode of Dr. B Talks, where we are also having a simulcast broadcasting with Sowetan. So yes, please feel free to be glued in to enjoy the conversation today. But importantly, you can also start preparing your comments for the comment section. Don't forget to follow the page Dr. B Talks. I know most of you are viewing the page. Most of you do get the invites, but let's please click on that follow button to make sure that at least you don't get left behind, because from next week, the 20th, we would be using the platform of Dr. B Talks as our page for these sessions and conversations and anything that has got to do with Dr. B Talks. So we don't want you to be left behind. So please feel free to follow the page and make sure that at least you are part of the journey, you are part of the conversation, and you are part of the family. As I always say, that this has now become Dr. B family, and Dr. B Talks, we are together always. Please relax. No, we are now our Dr. B Talks family. It's a very, very relaxed family, very accommodative, very flexible. So yeah, I know that we sometimes think that we're coming to this big thing, the studio and whatever. So where it's a calm environment. So you're just gonna enjoy. My viewers are not bad. You've been there as well. So they are just gonna put in some few comments and questions for you, but not too difficult questions, don't worry. So yes, welcome. We are going to start promptly at 1800 hours, and this is yet another exciting episode of Dr. B Talks, where this month of April we continue to dedicate it to caring for self or self-care. I did say the other time I'm choosing to use caring because I want people to be reminded that they must put in an effort and be part of the journey and be part of taking responsibility. It sounds as if I say self-care, I leave it hanging. So I choose to say caring for self so that people can know that they must take responsibility and make sure that they are part of this. And before I do the welcoming, yes, it is now exactly 1800 hours. Can I please get some thumbs up and some comments and some hearts and love to confirm if the audio is fine as well as the view is fine? So that we don't leave anyone behind. So if you can just please just raise your thumbs up, raise your hearts, raise your and maybe just comment to say that we are good to go. I see that Nompilo is in, Nolbabalo is in, I see Tabisa is also in. If you can just give us a thumbs up, then we are good to go. Yes, the ones that have said they are in should give us the thumbs up. We're waiting. So that we are good to go. There you go. I see that we are being told that we are 100% and good to go. Thank you very much. It is now exactly 1801. And it is our time. It was our exciting moment of Dr. B Talks. Every Sunday we get tuned into Dr. B Talks, and this Sunday is no different. We are here to bring an exciting topic. Our month of April we have dedicated it to caring for self, and today we are going to bring and kickstart that month. But before we proceed with the topic and issues that relate to Dr. B Talks, we are also mindful and continue to remind you that this month has been dedicated to be an autism month. So as Dr. B Talks, we are encouraging that people will always support the initiatives that are there to promote, but importantly, care and support those that are caring for those that have been diagnosed to have autism. So we continue to give you, even on our page as well as on the columns, we continue to give you some updates in that relate to information related to Autism Month. But let's also share with you that yesterday, the 11th of April, again in terms of the health calendar, it is our day that is regarded as World Parkinson's Day, which is observed every year on the 11th of April. And this one is to raise global awareness of Parkinson's disease, which is a progressive neurodegenerative movement disorder affecting millions. What that means in simple English that I know, not this one of the academic and the serious people. What it means is that it is a disease, progressive disease, that also affects people in terms of their movement. And we would just continue to share on the page some information related to that. But we just wanted to alert you that yesterday was indeed World Parkinson's Day, the 11th of April, which is meant, or the awareness is meant to make sure that we educate the public of the symptoms, which are tremors, stiffness, and the balance issues. But we'll have more of that on the Dr. B page talks. Thank you very much, and welcome once more to our simulcast broadcasting with Sowetan Live. I am not alone, which is very obvious because you can see I am not alone, and it is not AI at all. Instead, I am with my guest. We have brought you an exciting show for today. We did say last week that we are starting our show because we want to make sure that we take care of self, and we said there is no other way but to start by focusing, amongst other things, on issues that relate to health screening. We just wanted to make sure that we are able to protect ourselves, to care for ourselves, but importantly to be ready to face any other eventualities when it comes to screening. And I had asked her that I am not going to introduce her. I think I might not do justice in terms of the resume that she has, but I'm more than excited to present to you our guest for today, who is a specialist in terms of the field of occupational health, who is currently practicing as an occupational health nurse. I almost said, no, I won't go there. I won't go there. She's been in the field for some time. I met her as a ComServe nurse in the corridors of Eastern Cape Public Health System and Eastern Cape Hospitals. So I said I would rather allow her to introduce herself. So Philela, please welcome to our platform, Dr. B Talks, and please feel free to do a brief introduction in case I don't do justice and I mention when you were still a ComServe and how you were then. But we're not there now. We are here now. The occupational health nurse. Please feel free and introduce yourself to our viewers.
Okay, hi everyone. First of all, Doc, let me correct you. I met you as a student. I was still a student nurse when I met you. So now I'm a qualified professional nurse.
Exposing my age, but it's fine. Exposing my age now.
Okay, my name is Philela Luvuyo, like the doc has said. I'm a professional nurse who has specialized in occupational healthcare nursing. My specialty focus mostly on prevention and early detection of illnesses and the well-being and in the workplace. It also prevents illnesses in the workplace, and by promoting physical and emotional support to employees. Yeah, so I focus mostly, like it says, about occupational health. So the occupational focus is on the well-being of employees in the workplace.
I thank you very much for that introduction. And I think one thing that our viewers are also going to be appreciating is that we try at Dr. B Talks to have a flow in terms of the conversations we are having. When we were doing the month of March, we were focusing on human rights. And the last episode we did was to assist employees in terms of understanding what their rights versus the workspace. And I like the fact that when you are emphasizing your qualification and your workspace and your expertise, it's also again talking to what we're trying to do to empower people, to say you are trying to be here to empower people when it comes to them as employees and understanding and their safety and being protective in the workspace. So thank you very much for that introduction. We're just going to have a conversation. We're just going to have a conversation where we want to empower our viewers. And for those that have just joined now, thank you very much for joining, and welcome to another episode of Dr. B Talks, where we are also doing a simulcast broadcasting with Sowetan Live. And today's topic is mainly about caring for self, and with a specific focus on us focusing on issues that deals with health screening. We even termed it here to say it's about checking today but protecting for tomorrow. And what would you say is a simplest way of encouraging or making people understanding the importance and the value of just mere screening. Because sometimes people think that we are being difficult or we are exaggerative when we talk about issues that relate to screening. Maybe before you answer, I also want to share that I found it very interesting when I saw a poster where someone was actually very interesting for our topic. This person was actually trying to complain that in the hospital they went to, they were then referred to go and screen. And this was very interesting that you were surprised that when people are being encouraged to go there and screen, and this person is now complaining that how can I be sent from pillar to post. This post was on Facebook as we were preparing for the episode today, and it's written as follows. Amanes ase should I, it was in public, it was on Facebook, should I mention the clinic? Okay, let's mention the clinic. Amanesi wasengangelizwe clinic awasebenzi, into ayaziyo kusehlisa esonyusa kula clinic. Uthunywe ifile yakho, xa ubuya kuthiwe hamba ochama, xa ubeka umchamo kuthiwe hamba okhohlela, xa uvela okhohlela kuthiwe hamba ohlukuhla umithi, xa ubuya ekuhlukuhleni kuthiwe hamba obeleka uyazala. Ndincedwe ichomi yami esekliniki wathi uyakhawuleza uhoyo umuntu uyasebenza nyani owalapha amanesi. So the comment here when this poster came up was from a fellow viewer who is consistent in our platform, who is a nurse. You might know her from Bishop Hospital. Yena, she was saying, nangu umuntu ekhalaza exilongwa nohlolwa ekliniki. Ufuna ikliniki engazomjonga iTB, engazomtest pregnancy and then tell her to start ANC. Iwari yam ngaba bamgqibelayo ukuba awasebenzi amanesi enza lonto. I found this very interesting because this is exactly what we're trying to empower people about today. Why would we be advocating for screening and why we want to encourage people to screen? Because we're trying to avoid this thing of people thinking that it's an extra work or they are being sent from pillar to post, whereas there is something that we want to achieve. So what would you share with us to say, why should people be available, comfortable, but importantly even come in and say, I am here to be screened in Luvuyo Bayeni without necessarily being forced to go for screening? Yeah.
Okay, first of all, screening is very important because it helps you to know, to have a good health and to know symptoms even before your health deteriorates. You know, our illnesses can be picked from getting screened. I will make an example with HIV, which is more common than TB. You can sit and not feel the symptoms for years and carry on having the HIV. But if you go and screen, it helps you to know your status very early. It also helps you to be initiated on treatment and to make sure that the treatment works effectively on the early stages. Unlike going when your health has already deteriorated, maybe you are on your stage 4, or same applies with cancer. You go and screen when you're already on stage 4, meaning the last stages. If you had gone early, it would have made you identify the problem, and then you, even before the symptoms show. So it is very important to go for screening so that you can know what's going on with your health, and you can also be positive. You know how good it is to know that, to know the state of your health. You know that you clear from blood pressure, you clear from diabetes, you clear from cholesterol, because not knowing all these things that we take for we take them light, like diabetes, high blood pressure, they are very powerful at making your health deteriorate and having a huge impact. Yeah, so it's very important to get yourself regularly screened so that you can know where your health stands.
So I think the emphasis here, if I get you correctly, is to remind viewers that in actual fact, as much as it's us who says come for screening, the benefit is not for us. The benefit is for them.
For them.
That you would know or pick up any other issues before they even become symptomatic. But also, I think what I liked most was when you spoke about issues that even relate to your own self-esteem and all confidence. I think you were saying, you know how nice it is when you know you don't have. You see, so it's also a question of also benefiting the person when it comes to understanding and living confidently and comfortably knowing that they do avail themselves for checkups, they do avail themselves for screening, and also importantly, they know their status as at that time, because they would know that I just recently screened and I'm going for my next screening again. And I think also maybe it's on the same breath, it's also encouraging and maybe a call and a reminder to us as health workers to say we should also not get tired of encouraging people to screen, because we are agreeing that it does help and benefit. I like that you mentioned that sometimes people come when they are symptomatic, and I think you would agree that especially your exposure, which may also come in as a good example here, that you would go and want to assess people in the workplace. These people are ordinarily working, and some of them will probably tell you that, no man, we are healthy, we are fit, Tina, we are coming to work every day, and boom, you discover that when you're screening, you pick up things. So I think it's something that maybe you can also share and express to people that when we have these programs of screening, it's not because we don't have time or anything else to do. We actually know that there is value out of them, and maybe share with us, how does it make other people feel when all of a sudden, when they probably thought they are as healthy as an ox, and now you will say, actually, I'm picking up something that I'm concerned about.
Okay. As you had touched that, when we have this screening on site, especially at workplaces, it is very important, and they work very effective because it helps employees to know what they didn't know. I'll make a simple example. You'd have a clinic on site at a workplace. So employees have this tendency of just coming to the clinic and be like, no, can I have pain meds? Can I have this? Not knowing that they would become very difficult when you say, okay, I am not a pharmacist. I can't just administer. I can't just administer pain meds. I'm an occupational health nurse, and I am interested in identifying any problem that may cause you to have a headache. So when you do a thorough screening to an employee without just rendering pain meds, it helps you to identify what is a problem. So to others you could find that headache that the employee has been constantly experiencing, it is due to an elevated blood pressure. So them now having been screened and checked their blood pressure and diabetes, and then it gets them to know that okay, so when I was having this headache, it was because my blood pressure was elevated. Ne? So once they discover their problem, now it helps you as a healthcare worker to do a further management by referring a patient for further management, or where they could go to their general practitioner or nearest hospital for further management and for further screening and be initiated on treatment. So you feel good when you have identified a problem, because you have prevented that employee or that client from just sitting there not knowing what's going on with their body. So when you do these regular checkups, you don't have to screen just because you're experiencing a symptom. You get to screen regularly just to monitor. And some of these illnesses, doc, they come because of a lifestyle.
Nice.
And sometimes they are inherited. So if you know that in your bloodline or in your family there's someone living with high blood pressure, sugar, it is very important to go for this screening. Like, you must constantly get checked, because we don't always live a good lifestyle. We don't always exercise. We don't always eat clean. So in that way, you are making means of preventing whatever that may take place because of the genetics and your lifestyle.
So thank you for that. And maybe, okay, well, apart from the part of reminding me that I'm not exercising regularly, I was just on the same wavelength with you, and I felt like now you are being personal, please. So I think the issue that you are also raising is that one, screening should not be interpreted as consultation when you have got symptoms.
Yes.
Please, people that have been going because they've got something, they mustn't say they are screening. When you ask them that, when last did you screen, they mustn't say last week if they went knowing that they've got a problem or a symptom. So I think it's something that we need to understand, that those two are not the same. The minute you seek for help because there is something, you miss this step that we are talking about today of trying to be proactive, trying to be caring for self, but also being optimal in terms of understanding what is your health status. So if you go because you've got a problem or any symptom, it means you are no longer now screening, you are coming for consultation. But now the other issue that I picked up on your conversation is that you are also mentioning that we need to appreciative that we do have different risk profiles. And you were even touching on them, that sometimes there are family issues and sometimes it is our lifestyle which creates another risk issue for us. So it means then we need to also appreciate that we need to have an opportunity or maybe an effort of understanding what is my risk profile. And you would get that as well when you come for screening, because you would not just screen you. We may be asking you these questions and we may share with you that now that you have answered these questions, this is your risk profile. So I think another benefit of just coming in for screening, you end up knowing and understanding as well now what becomes your risk profile, because from the questions we'll be asking and the assessment will be able to tell you that yes, we're going to screen you, but currently this is what we think or we look at being a risk profile for you. And also the other issue that you have mentioned as well was the other advantage that also is coming up is that you get an opportunity if you go for screening without any symptom, and we may pick up something. We may even try and assist you before you even get to symptoms. And that reminds us that on Dr. B Talks column in Sowetan, last week we wrote about TB. And one of the issues we were saying there was that not everyone with TB is symptomatic. So these issues of screening talk to exactly that don't wait for symptoms because you might not be having any symptoms. Let's just quickly check. Our viewers are commenting as well. Tabisa is saying that knowledge is definitely power. The thing is, not knowing doesn't change the facts, but knowing helps you deal with the facts. Most times, in the worst case scenarios, the results are just a lifestyle change for your own good. And there is also a comment from Membata. OTH, I have done my 2026 screening and thank you. I think you are saying you have not done, because you are saying thank you for a reminder. So yes, we are happy that we are reminding you. And yes, please, actually we should be asking people to raise hands who have done their screening. Do we start with us or?
Have you done yours?
No, I didn't say you must ask. I'm just asking. Maybe we must ask. We must ask people to raise hands if when last, or if they've done any screening for this year 2026. I think I was just testing my machine for the blood pressure, so I don't think I was screening because we needed it for just the health corner during the Easter service. So I did not want to take a machine that's not working. So I did test and check my blood pressure, but I'm not sure if I was screening or not. So blood pressure, yes, I can say I can tick for this year. Hey, but do these watches count as screening when they tell us what we're doing?
They always emphasize that do not rely on your watch. It's not your doctor, it's not your accurate blood pressure machine or whatsoever that you use for screening.
Okay, guys. Please, it's not me, but yes. Another lesson, guys, when it comes to screening, yes, we do have some certain gadgets and lifestyle gadgets that we have, but the message is please do not rely and solely use those. Yes, they can be used to probably supplement what you would have done or what you know about your status if you had gone to check and you have screened and you know what is your baseline when it comes to your heart rate, when it comes to your blood pressure. So you may sometime and again just have them as a reference, but don't say I have got a fancy watch. Not mine is. I've got a watch that tells you everything, tells you to get up, to walk, to sit and whatever. That is not enough. We are talking about health screening here and we would like you to go for your screening. Thank you very much, Membata, for being honest with us like me to say you have not gone for your 2026. I think I am not getting any hands from people who have gone. So it means everyone who is watching here has not gone for their 2026 screening. And please, from tomorrow, let's go and screen for 2026. And just tell them that you are turning a page, you want to live a healthy living. And Dr. B Talks had just scaled you for not going for your screening. Thank you very much. I see that we do have confirmation there that indeed she has not gone for 2026, and Buli is confirming that indeed this is so inspiring. I just wanted to touch and also add that amongst the benefits that you have mentioned, I've also noticed that we also offer issues that deal with what we refer to as comprehensive coverage. Because when you come for screening, unlike when you have got symptoms, we are able to pay attention to you. We are able to give you time to probably just screen you in general. So I think that's one of the advantages that are there, to say we are able to give you a comprehensive benefit where we are able to screen you holistically. So I think that's another issue that is reminding us that don't wait for symptoms, because when you go for symptoms, we may be tempted to sway away from screening you in general and be comprehensive in approach, but try and run and be fast in terms of attending to the issue that relates to your actual symptoms. And I think the other issue there that talks to what we spoke about, the issue of being preventative, they say we also do have some preventative perks and additional preventative care, because now you would have been screened, like you said, lifestyle. If you come back, but oops, now I survived, my blood pressure is still fine, but I've been told and I hear that if I take too much alcohol, I take too much fatty food, I take too much bright meat, let me reduce so that I don't fall into the trap. So it helps with being preventative. I see as well that we do have a comment from okay, I'm being accused here now that I mustn't paint all of us with the same brush. Tinyana Nogukanya is saying screening has been done for 2026. Thank you very much. Big ups to you. Thanks, Doc. Very important topic today. Ladies, don't forget to get those pap smears done. Exactly. We will definitely touch on that. Mio Affection as well is saying they are done with their 2026. Tavisa is saying, I used to do it because it was required when I worked in the mine. Since then, Dololo. But yeah, we appreciate the honesty. Thank you very much. We listen, we don't judge, guys. By the way, we listen, we don't judge. So yes, I think there is that weakness that we know about these screenings. Is it fair for us to say we might not have opportunities, we wait until we see them at the workspace, or it's actually what we're trying to change now, to say don't wait? I don't even want to ask when last were you working at the mines. It could be 2-3 years ago. So you see the gap now widens a lot. So what would you advise people in terms of where is the access for this screening, so that we don't all think that we must wait for being in the workspace? And some of us here as viewers, we might not even know the definition of workspace. We might not be working, but we do want to screen. So where would you say there are different opportunities and areas where people can avail themselves and explore and go for the screening?
Okay. I would like to first highlight at a workplace setting. The other reason that I've picked for employees not to go for these screenings, it's because one, they don't understand why are the screenings important. Two, they say it's time consuming because there's a lot of forms that they must complete. Sometimes those forms are very important because our medical examination forms, they have what we call family history. Then others would be like, but why am I being asked this? Like you touched that some of these illnesses are from our blood stream or genetics. So when you ask that family history, you are trying to identify, if I happen to screen my employee today and then I pick that they have an elevated blood pressure, then you can easily tell, okay, this is genetical or this is due to a lifestyle. So they mustn't be irritated or exhausted by the forms that they have to complete. There's also a psychological form which helps me even before I ask the employee, if do you have any mental or stress related, do you have any work related stress or any general stress? When I go through the psychological form, I can easily see that I'm dealing now today with a troubled employee. Okay. Then that's when I can introduce these programs we have at a workplace, where they can go for the EA programs, where they can get further management and screened and counseled further and be assisted to deal with whatever that is bothering them. So they must try and be patient with us when we give those documents. We understand there are quite a lot, but they also help us keep records, because keeping of records is also important. When something happens, you can always refer to those problems that you have identified for those from those forms. Then secondly, those who are not in a workspace, we have our government institutions. You do not have to visit a clinic when you are sick or when you have a symptom. Just make it part of your life routine where you go every 6 months. You know, when you do the 6 months is very important. It's very nice. So, you know, beginning of the year, you go for your physical screening. You can just simply say, sister, I've came for my physical screening. Or if you go to the GP, you can tell your GP that I've came for my physical screening. They will screen you for your blood pressure, cholesterol, sugar levels. They will check your weight, because sometimes these illnesses starts within your weight. You will know your body mass index, if are you obese or not. Then you know when you have a high body mass, that's when you can start acting, and you will get a thorough health education so that you can prevent whatever that may occur due to these findings that they may pick. And sometimes you can have a patient walking in at a clinic or hospital, and then you pick that they have an elevated blood pressure. Sometimes it's wise not to immediately initiate treatment, put them on treatment. Give them health education. They must have a broad understanding about what is blood pressure, how can it be prevented. Sometimes it can be due to your lifestyle, and sometimes it can be due to being inherited. It's in your bloodline or in your family. So once they get to know that information, you can encourage them to do something, like to start acting, because they are now pre-hypertensive. So when you're pre-hypertensive, it means it is starting to show. Sometimes it can be there, and sometimes it can start showing that you stand chances because of these two things. So once you know that you stand chances, that's when you can start acting towards your health by applying prevention ways, whereby you exercise. You'll change just your lifestyle modification by eating well, exercising, and taking some preventative. I know someone would come to me and say, no, I'm taking supplements. There are these diabetic supplements that they always talk about, but no, I'm on some. But sometimes it doesn't mean that when it was identified, be in denial. Get monitored until it's confirmed. Then once it's confirmed, be initiated on treatment, and then try changing your lifestyle.
I want to remind the viewers what you were saying, to say, when we screen you, please note that it does not mean we want to diagnose you. In actual fact, we want to help you. And I like the fact that you said, please don't be scared to come because you think we might pick up blood pressure. In actual fact, we might even understand that there were other issues that were affecting you. Hence, you mentioned that you sometimes get to understand what is your mental health or stress levels. So don't think now that we're gonna maybe find an elevated blood pressure, it means therefore we are gonna now diagnose you and say you're hypertensive. No. In actual fact, that's why there is a benefit in coming for screening, because you should come with just having an open mind to say, I'm going to be coming for screening, and thereafter I will see what happens, and will go with us in terms of the journey. Yes, you'll take it from there and go with us with the terms of the journey. And by the way, when it comes to just simplifying the issues of screening, we have mentioned here that when we want you to walk in, sometimes it doesn't have to be about hectic issues. All we want you to know for this year 2026, those of us who are raising hands that this week we are going to go for screening, starting with me, all we want to know as a base, Jay, is where are you when it comes to your blood pressure, where are you when it comes to your blood glucose, where are you when it comes to your cholesterol, and where are you when it comes to your body mass index, so that we can assist you in terms of understanding what becomes your risk. So in principle, those are the basics that we want you to come through and understand. So yes, we are going to come later on to talk about, obviously, there are those that we will refer to as cancer screenings. I think a colleague had mentioned something about pap smear. And also we would indicate in terms of those that are age related. You might know that we usually talk about prostate for men at a certain age. So we'll come back to that. But please, for now, don't be scared. This week, put on your diaries now, open your calendars and your phone. Make sure that at least you are going to be able to go for screening sometime this week. There is a comment here, interestingly so. And Ntsikelelo Sityana is saying that we know to Buli that you also have not gone for your test this year, screening. So please join us this week as we all march to go for screening. As well as shares, I haven't done my 2026. I'm embarrassed because I always advise my patients. It's very interesting that I'm not alone in this platform. We are many, but we're going to change all that this week. I'm sure next week when we come in online, all of us will say, yippee, we have been there, and we're going to have a 100% pass rate. Ntsikelelo is saying, can we rather remain employees or clients when we go for screening? This name of being referred to as a patient is kind of scary. Not that we are not, but we don't want to face reality. But most healthcare workers get to know their their conditions already at an advanced stage. And I think it talks to what we were saying just now, that when we invite you for screening, please come with an open mind. We are not diagnosing you of anything, but we just want to help you to be preventative and know exactly what are your risks and what is it that could still be manageable in terms of either lifestyle, in terms of even repeat consultation. We don't always mean that we are going to be diagnosing. But interestingly for me, is this issue of patients versus clients versus the interesting part of it is, could we sometimes, either from our own terminologies that we use or our own, I don't want to say attitude because it's always linked to negativity, maybe our responsiveness or our approach, could it also be indicating, as mentioned here, that we may sometimes, one way or the other, be resulting or contributing to people not being as free and as opening in terms of that? He is saying, if you refer to me as patient, sometimes I might feel a bit hesitant, as when I just come through to be seen as maybe a client or as a citizen. So would you say sometimes the terminology, the responsiveness, and maybe the awarenesses that we make, do you think they sometimes to a certain extent contribute to the turn up or how people perceive? Please feel free as well to comment on the comment section and share with us your experience when it comes to maybe the attempts that you have made to try and go and screen. Maybe it was in a campaign, maybe it was in an event, and what was your experience when it comes to those? Yes.
Okay, on the terminology of patient, I love Tsikelelo's point. I think we as healthcare workers, we need to differentiate. Yeah, when you're at a hospital setting, having your patient inside the ward, you can now address that person as a patient. But in a workplace, in a clinic, in your practicing space, I think it is important to use the term client. At a workplace, it's an employee, because when you're liaising or communicating with the HR will have more understanding when you're saying the employee, because they deal with employees, because this is a workplace. Then in your practice at a clinic setting, if I'm calling you Dr. B that I want to discuss my client, I will address my client as my client, but I have a client with this problem, can you please assist me? You will also have an understanding that, okay, sister is in a clinic setting or in my practicing setting, so you haven't. Then if I call you, we are in a hospital setting, and I say I have a patient here. Okay. Now we understand that we are at a hospital and discussing someone who is maybe at the emergency getting attended, or someone who is inside the ward. So yeah, that terminology does give a bit of anxiety to employees when you are going to address them as patients, because it's as if now they are really sick and hopeless. Yeah.
Yes, so yes, let's take a lesson there. So please, yeah. So even when we report those of us who are participating in the screening programs, please, let's be mindful that we can say that we have done screening on so many clients, and these are the conditions that we have picked up. So let's be mindful that sometimes the terminology that we use has got a risk of maybe creating a wall for people not to come through, and people might not feel as excited or as motivated to come through. But also we still want to remind you colleagues that can we please get to a habit of trying to have conversations. I know that sometimes this becomes very, very difficult, and times it takes a lot from families to have conversations about health conditions within the family. I think it has been made worse now with the technology, with us being on the phone. You would find that all 6 of us were seated in the sitting room, but we are all on the phone. No one is talking to each other. And I think that's something that we need to probably encourage and advise people to bring back. That let's ask our parents, let's ask our elders in the family, what do you know as medical conditions in your family? I, for one, I always share with people that it took time, and I think it took until I was at med school to probably suspect, though we don't have a confirmation, that my dad could have probably had some lung condition. Because whenever there was a narrative about how he demised, I know my mom would say he was a heavy smoker. And I did not know the significance thereof at the time. And then would say, no, he was sick with a lung infection and ultimately he passed on. But now when you look in retrospect, you're like, the risk was there in terms of heavy smoking, and that can predispose to even lung cancers and all those things. But so it's important to have such conversations in the family to just have a sense of what could have been. We do know that there are families that indeed, especially nowadays, would know that my mom had a cancer, my dad had a cancer, prostate or whatever, lung cancer. So let's have those conversations so that we can empower, especially the younger generation and as well as ourselves, that when you are asked what is your family profile, you don't even get irritated that these questions are too long. These questions are asking me about family. Why should you be asking me all these things? Because I'm just here to screen myself. So it's important indeed for us to be able to have a bit of an understanding of why is it that we are interested in these questions. And I also wanted to emphasize what you mentioned, that some of these questions, as we screen you, they are actually part of us helping you. Because as we screen and we ask about the mental condition, we ask about your anxiety levels, we're actually trying to help you even now to say that we think this is what could be contributing. And indeed, we do know that some people might have an elevated blood pressure because this person was even rushed now from work. He's anxious. It's like, I was told, rush to the clinic or whatever. I was busy with something. And so those things also help for us to be able to help you. So please feel free when you come for screening. Be as relaxed as you can, but also be as accommodative when it comes to the questions that are there. But also we would like to encourage you to be as open and as transparent as you can, especially when it comes to answering those questions, because they in the main would also help us determine your own health profile. I see Tamsa came back here to say, while still on the topic of screening, can you please share about the genetic screening and your thoughts about it? As well as Tsigelelo is also saying, by the way, doctor, I recently done my medical assessment last week. You are adding to the 2 people that have done it this far for this year. Big ups to you as well. I think when it comes to the question from Tabs, in terms of issues that relate to genetic screening, obviously we've got 2 elements that we can respond to there. One is what we're talking about when it comes to conversations of having a sense as to what are the risks in the family, and obviously the genetic predisposition or risks that are there. So this one, it's what we are encouraging all of us get to start engaging in when it comes to just having conversations at home. Also paying attention where we know that we do have our elders and family members that have passed on, just to also understand what could have been the medical conditions, especially if indeed they are reported to have passed on because of medical conditions. Because we do know that when it comes to risk classification, there are conditions that are known to be familial or go with genetic traits. So it's always important to know that. So that's one part to answer it. And then obviously the other part of the actual genetic screening and the testing. Well, there are those that are at risk and we may be offered, especially when it comes to advanced maternal age, where people may fall pregnant at the age that is advanced to the average. I'm trying to be politically correct here. The average age of people falling pregnant, because we do know that there are people who still have successful pregnancies beyond that age, but on average there is a maternal age. So once you have gone beyond advanced maternal age, those are the conversations that your obstetrician and your midwife will have with you, that the risks are higher of your baby having some genetic malformalities, and there may be those options of saying, would you want to go for some of the tests, especially where you are able to access them. So there is that route, but there is also conditions where, in terms of us making a final diagnosis, we may consider and may go as far as having to ask in terms of your genetic testing and screening, so that we are able to ensure that we do get the final and the actual diagnosis. So yes, there are those options, but what we can tell you is that when you have to go through any genetic testing, you may also be taken through counseling first thoroughly, because as much as it is a test, it may give you also negative or positive results. So you also need to have that in mind in terms of the counseling thereof. And like we're saying, we would probably be sharing with you all the pros and cons of doing even the actual test. So I hope that covers you in terms of your interest or your question when it comes to the issues that relate to genetic testing. As we move along, for those who've just joined, welcome. We are on Dr. B Talks, also having a simulcast broadcasting with Sowetan. We are in the month of April, where we have dedicated the month to focus on caring for self, and today we are dealing with the importance and benefits of doing a health screening, as we want to encourage all of us to be able to go for voluntary screening. Please, let's volunteer, let's go for screening. We do have what we usually refer to, and I think we mentioned it earlier on, issues that relate to cancer screening. And I think that also talks to what we just spoke about family history and family conversations. That it's always a better option when we know what our family history has been when it comes to cancers, because we get to be in a high alert when it comes to those cancers that we may want to screen on, and as a result, we also would know when to go early when it comes to issues of that. But I'm sure even in your exposure, you also do have a few that you would like to mention that we know are available and are being used when it comes to cancer screening, so that we can empower and share with our audience when it comes to issues that relate to cancers.
Okay. Maybe I must just summarize the common screenings that can be done, not only just cancer.
Yes.
Yeah. So one, blood pressure is important. You must know your numbers when it comes to blood pressure. You must know your
Show me your number. Know your numbers.
You must know your sugar levels, because it can happen that in your family there's someone with diabetes. When I talk about sugar levels, I refer to diabetes. You must know your cholesterol levels, if are they normal or not. Then with cancer, for females, it is important, especially females 30 and above, it is important, or let me say females that are also sexual active.
Yes.
You must go for your pap smears, you must get screened, and pap smear assists in detecting if do you have any early signs and symptoms of the cells in your cervix, ne? And then the other screening is mammograms, where you go for your breast examination. Yes, you can do self-examination. I know in health facilities they do educate clients to know how to examine them. Even in the workplace, when there's awareness such as cancer awareness, we do educate employees on how to self-examine themselves. You can do it while you are laying in bed, you can do it while you're standing. Then if you know that you are above 40 and there is a history in your family of breast cancer, it is important to go early and get screened. I know sometimes doctors can be difficult, because I know with myself, when I asked the doctor to screen me to take me for mammogram, he was like, but you're young, you can't have anything. But I was like, no, I know in my family history there is cancer, so I would like to know, because sometimes I would feel ABCD. Then he gave me a referral letter to go for the mammogram. But when I got there, they didn't do the mammogram, they just did the ultrasound, because they were still they still believe that
they looked at your face and your age.
It's too early for you. So sometimes explaining to your health practitioner that there is family history and why you need it is also important. For males, prostate even for males, they can do the breast examination. Yes. They can have breast cancer. and they're not aware that males can have what is called the breast cancer. So it is also important for males to examine their breast as well, following the same processes that we do when females examine their breast, and also getting screened. I'm sure they would be done the ultrasound screening when they're examined. And then the prostate, which they always run away from. Men hate that test. They hate that test, but with technology,
Yes.
with technology, I love what technology has done with research done in the health. It has tried changing the way of doing that test. I saw now it is done the same way as the rapid HIV test, where you can take the blood and then test the blood whether it's negative or positive.
So you mustn't run away like we used to.
No, there's no need. There's no need to run away, Sean. There's no need. Another screening for cancer that I'd say people are not aware that it is very important. Just randomly ask your doctor to refer you to what you call them for you when you go for your colonoscope, because some problems are there. You would constantly have these abdominal problems where you feel problems that are uncomfortable with your stomach, some constipation, you ignore constipation, only to find out in the later stage you pick that you have a colon cancer. So it's another screening that we do not emphasize how important it is. You wait to have a serious problem with your stomach for you to go for it. I always advise my mom, with your age, go screen for everything.
Wow.
Yeah.
I think you've touched one. Let's remind males that when we talk of screening for cancers, we don't only talk about females. Also males are supposed to participate, and also maybe just to also emphasize that when we talk about cancer screenings, we do know that as we had a long conversation on the family history, that also helps a lot, and it does help, and like she said, shared her own experience, that when you have got a better understanding of your own family history, it also empowers you to be able to be part of the decisions of your health. Because like she said, sometimes we get to be looking and judgmental and overwhelmed that this is a young person, we don't expect this, only to find that when it comes to the history and the background and the family traits, there is a risk of some of the cancers that are there. So it's important that you must be bold enough to share and to know about your family history, and also understand that it forms part of you making your health decisions and the management plan thereof. But also I am also mindful that I liked how she easily corrected herself when it comes to females who must go for pap smears. Yes, we don't always align to age only. We do know that some of our lifestyle and conduct would be such that we get exposed earlier to certain things, even though previously they were related to certain ages. Just like the example of hypertension and diabetes. Previously, when we grew up, when we were at med school and training, there used to be an age, but we have noticed that there is what we refer to as disease of the lifestyle, where people now, in terms of how they live, they now have changed that scenario of certain ages and certain conditions being relevant for certain ages, and they get them as young. So now the issues of lifestyle are also important, and let's just volunteer to go for the screening. Let's not wait for the ages. Let's just go and be honest. But obviously there are those that we may call them mandatory when it comes to certain ages, that once you have reached a certain age, we would like you to be consistent in going for some of these. We've mentioned the issues of pap smear, we've mentioned the issues of mammogram, but we've also mentioned the issues of screening for prostate. You didn't tell people why men did not want. At some stage, the examination for prostate, which is what has been scaring all men away, it would also include an examination which we refer to as perectal examination, and that is what has been scaring a lot of men. Whenever they hear and they want and they think about a prostate examination, they say, I am not going to allow anyone to put a finger and examine me. So yes, we just want to remind men that indeed this is an important issue, as much as we might seem as if we are jovial about it, but yes, you need to go for screening, and you need to make sure that at least you don't wait until it's late, because the unfortunate thing now is that by the time most men come through, they would be complaining of symptoms, and by the time they get a chance to be assessed, you would find that there is already a confirmation of cancer, which could have been maybe picked up or prevented before. So we do advise that please, irrespective of whether you might think that some of these screening or examinations are uncomfortable, please understand that screening is very important, and it's meant to save your life, but also to help you have a preventative life in terms of your health care, as well as try and pick up if there is anything that could be picked up early enough, then that can be done. So please feel free to just go and consult and make sure that at least you are able to go and screen. And I think maybe just to remind our colleagues and viewers out there that the issues of especially for females and requesting pap smear are also linked to the program that is out there that deals with the availability of vaccination on HPV, which we're going to talk about month end, because there is a realization that sexual exposure is earlier now than what it was before. So people must not wait for a certain age to go their pap smear. So please, should I attempt to ask all our female viewers, or people are going to say I'm not gender sensitive, to just find out if how many of us have gone for our pap smear in the last 2 years. I'm being gracious now. In the last 2 years, please, can we just get some thumbs up and thumbs down and hearts to see if indeed we have been mindful of this issue of us going for our pap smear as part of our screening, especially cancer screening. And I also wanted to just also maybe remind males on what you spoke about when it comes to breast cancer, as well as the examination that they can do for themselves, self-examinations as part of the screening. So indeed, the cancer is gonna stay on the cells which are breast cells. And yes, all of us, male or female, we all have got breast cells. Please, let's repeat, all of us have got breast cells. So we are having an opportunity to be having breast cancer. So it is not only for females. Obviously, when we discuss cancers in the 3rd month from now, we would share why it's predominantly for females, and obviously why we have different risk profiles. But in terms of principle, please, if anyone before today thought that breast cancer is only for females, we would like to correct that and empower each other here at Dr. B Talks that breast cancer can also be found in males, because we all have breast cells. I see that our females are very shy and don't want to confirm if they have done these pap smears. But please, let's encourage each other, especially if you know that even those of us who are still caring for our mothers, please do encourage our mothers to go and do pap smears, because you also would not want to pick up or hear later on that maybe your mother might have been at the risk or might have developed cervical cancer. So it's one of those easy things. Just accompany your mom and ask her to go for screening, and you could be able to help and save. There is other screenings that we usually also do and would like to touch on, and I think sometimes some of these screenings that we hear about as other screenings, we always want to associate them as maybe waiting until it's late, or waiting for a need, or waiting for a symptom, or waiting for an incident. HIV screening, please, it's part of other screenings that people can go for, and you don't need to necessarily wait, especially if it comes to you wanting to, which is a high risk, that you want to gauge your partner, gauge your sexual activities. Please, let's if you do know that you do have an exposure to a risk of HIV transmission, which might be either workplace but also sexual activities, so please do go for screening if you know that you've got exposure to some of the transmissions of HIV. Not that we're saying people must be seen as if they are judging each other, but we are encouraging that you must take care of self. Like we said, this month we are worried about caring for self, so we also encourage that. An interesting one that I also came across when I was doing this preparations is the issue of gender screening. I think our colleagues in the dental fraternity feel that we only think of them when we've got a toothache, and that's the only time people look for where can we find dental services. Yes, no, we're supposed to go for dental screenings, and we are encouraged that that is also part of the screenings that we need to be doing, just to routinely go for dental screening, whether it's just to look at the issues that relate to your own teeth, but also your own oral cavity. So please, we do encourage that as you are going to walk in and ask for screening, where there is a dental service in the facility that you are going to go through, also please try and ask that, can I please have some form of dental screening that I would like to be exposed to, so that at least we are able to say, for this year you have covered, and we are proud as Dr. B talks that we have managed to make sure that people go for screening. Thank you very much. Ms. Mbata has confirmed that she has done her pap smear last year on the 17th of June 2025. Big ups to you, and I think we also would like to encourage everyone else that has not gone, as you are busy doing your notes and finding your diary, looking at the dates that you're going to go for a screening. Please make sure that you also include, amongst others, for females when it comes to issues of pap smear screening. Wow, time flies. We're already I almost said you're lying. 1857. Wow. Yeah, no, we didn't notice. We would be wrapping up, and please, for those that are watching and those that were joining us for the first time today, we would like to welcome you. This is Dr. B Talks, and we are doing a simulcast broadcasting with Sowetan Live. And yes, this month is the month of April. Our theme for the month is caring for self. And today we wanted to kick off the month with issues that relate to us looking at screening and the benefits thereof. And yes, as you might have heard during our conversation, we are emphasizing that screening is not about the healthcare provider, but it is about you as a client. All the benefits that are there when it comes to screening, whether it be detected early or whether it be confirmation that you do not have anything, but also whether it be advice in terms of taking care of yourself, are all meant to benefit you as a person or as a client. So please, we are encouraging that people must just be able to go and just volunteer to go for screening. But important message from our side is that we are reminding that don't wait for symptoms, because once you come for symptoms, we would not want you to say or go around that you have gone for screening, because that would be now a consultation but not necessarily a screening. So we're encouraging that people should volunteer without necessarily having any symptoms and just go for screening whenever they have got an opportunity. Please, I know you have prepared some closing remarks. I didn't realize we were already at the end. What would you like to share and maybe remind as a take home and share with our viewers when it comes to the issue of screening as your closing remarks? Wow, I didn't realize we were already at the end. Wow.
Okay, to those that are fortunate enough to have these on-site clinics at their workplaces, please make use of those places. Don't feel that your time is being wasted when you go there. Get screened regularly and make it part of your lifestyle, getting screened. And for those, also listen to that health education that you'll get there, because it is very important. And always know that your health is your asset, and going for these regular checkups, it is your future. And early detection of these illnesses, it is your control. So you have your responsibility to take care of your health. And I'm sure sometime in some workplaces there's always a slogan, or when you go through the contract they will tell you that your health is your responsibility. Before you wait for your employer to take care of your health, but make it your responsibility. Even to any exposure, they will tell you that report any hazard. So once you report that hazard, it also assists you to prevent yourself from any illness that may be caused by a hazard that you're exposed to at a workplace. So reporting hazards is part of safety, and it also allows employer to create what is called a surveillance matrix, like where they check what medicals to conduct on a certain department. So take care of your health and prioritize it and stay safe.
Wow, thank you very much. I think that was the best punchline in terms of closing, especially for the topic of us making sure that we promote a screening. Once more, thank you very much for making time. You do know that I always say I respect your time because you have made an effort to be part of this family. So yes, it is now exactly 1901, and that means that we have come to the end of our show today, and would like to take this opportunity to thank you for always tuning in, for always supporting, and always being there as part of my Dr. B Talks family. Please don't forget to share and remind as many of your friends. I know some of them will tell you, no, we know, we've seen that page. Yes, you've seen it, but now we are saying click on that follow button, because as of next week, we are going to be doing all our platforms on Dr. B Talks. From the 20th, we'll be doing everything on Dr. B Talks. So please encourage everyone to follow the page. And yes, we are also having some of these conversations being put up on Dr. B Talks on YouTube. But importantly, also always join us as we continue to have a simulcast broadcasting with Sowetan Live. And yes, we do have a column every second Thursday that is out on Sowetan. Please support. I know most of you are digital, you find it on digital, but when you get a chance to bring something to your mom or your father at home, just buy Sowetan. Every Thursday second Thursday we've got a column called Ask Dr. B. And thank you very much for your support, and have a lovely evening and enjoy the rest of the week. Let's continue to support, especially those that are participating and also active in the awareness on autism, because this is Autism Month. Let's meet next week as we continue to empower each other and make sure that we are able to care for ourselves. This is Dr. B Talks and Dr. Luvuyo, Bayeni, host, and thank you very much. Thank you for making time, and thank you for the conversation. It has been a pleasure to host you for the show today. Thank you very much, guys, and that's it for the night, and have a lovely week ahead. Thank you.